Guys, welcome back to the channel. Let's continue with impaction. Last class we have dealt with bone removal, the guttering method. Now we will dealing with tooth sectioning and tooth delivery. Using the surgical handpiece, tooth is sectioned according to its angulation unless it can be elevated intact easily. Tooth sectioning is done using the surgical handpiece. Okay, and according to the angulation, it is sectioned. Then, generally, mesioangular teeth are split into mesial and distal half. Always remember, mesioangular teeth are split into mesial and distal half, directing the bird towards the root furcation. Okay, this is most of the cases, but not all of the cases. All the cases are dealt differently. Distoangular and horizontally impacted are often divided by cutting crown free from the roots at the neck of the tooth. If necessary, the roots are then divided. Okay. In distoangular and in horizontally impacted tooth, we first separate the crown part, then the root. Okay. Care should be taken not to cut too deeply lingually or inferiorly, because lingually there is lingual nerve and inferiorly there is inferior alveolar nerve. Lingual nerve damage chances are there. Tooth is cut most of the through but not completely. It is cut through and through but not completely, and split by insertion of an elevator. Okay, tooth is cut through and through but not completely, and then we put an elevator, we insert an elevator and then split it and then wedge the segment to fall apart. The intact tooth are sectioned, or the section portion of the tooth are removed from the socket using a crier. Okay, any elevator crier you can use. Okay. Now this is one of the example, the mesiolingual. So first we have cut the mesial part, then distal part, then both the root segment. Okay. In horizontal we have separated the crown part, then the root segment. This is mostly we do this, but every case is different. I am again saying every case is different, but generally it is followed. Now coming to debridement and closure. Curettage very necessary. Any remaining follicles or granulation tissues are removed. Then any rough or very thin bony margin around the socket are removed. This is bone filing. Then the socket and flap are irrigated with saline and betadine, and then flap is closed. This process is very important. Irrigation process, which is also known as wound toileting. Post-operative instructions are given along with the course of analgesic and antibiotic with follow-up. Okay. Now, what are the operative and post-operative complications? Operative complication, which is during the procedure, and post-operative complications are after the procedure. So, during the procedure, it can be hemorrhage of bone or soft tissue. If it is of soft tissue like blood vessels bleed, stop with hemostat. If it is bone bleed, then crush the bone at the point of bleed. Okay? We can use LA with adrenaline. We can use gel form, oxidized cellulose, and other hemostatic agent. Now, inferior alveolar nerve division or compression. If division is there, then approximate the nerve ending, and if compression is there, time is the healer. The inferior alveolar nerve has no surrounding soft tissue because it is present in canal. So, we can meet the nerve ending very easily. Okay. So, it can be. But in lingual nerve repair is very difficult because approximation is very difficult. Trismus can be there due to spasm of medial pterygoid. Okay. Trismus can be there during the surgery and after surgery. So it is both the operative complication and post-operative complication. Then there can be fracture of root due to injurious use of elevator, injury of adjacent tooth, same due to injurious use of elevators. Then there can be fracture of alveolar process and tuberosity or fracture of mandible. Fragile bone, ankylosis and excessive force can cause this. Soft tissue injury due to sharp elevators. There can be displacement of tooth in facial spaces, tooth in maxillary sinus, aspiration of tooth can be there, and dislocation of TMJ can be there. Okay. Now coming to post-operative complication, edema, pain, trismus, infection. These all are also the complication of local complication of LA. So we have dealt in detail about these. Hematoma also. Then there can be neurosensory dysfunction if lingual nerve damage occur. Secondary hemorrhage, pyrexia, ecchymosis are the red spots on the cheeks, TMJ complication, osteomyelitis and soft tissue necrosis. Okay, these are the post-operative complication. So we have completed almost all things including the complication, but there are few more things left like canine impaction and maxillary impaction. We'll see few things about them also in the next class. Till then, like, subscribe and comment. Thank you.